Daily coronavirus cases have doubled in the last 3 weeks nationwide, especially in areas with low vaccination rates. Now health officials are worried about the impact of the Delta variant on children and young adults. Omar Villafranca has more from Mississippi.
The large majority of people who are hospitalized in Mississippi are unvaccinated. The state has the lowest vaccination rate in the country. Only about a third of the population is fully vaccinated. Now doctors are saying that's putting children at risk. Across the state of Mississippi, 7 children are now hospitalized with COVID-19, fighting the dangerous virus in intensive care units. 2 are on ventilators. When you have younger kids who are now getting hospitalized, what do people need to take from that?
So what we're hearing is this is a mix of kids with underlying conditions and then some that were previously healthy. Dr.
Jennifer Bryan, chairman of the Board of Trustees at Mississippi State Medical Association, says children are more at risk when vaccination rates are low.
In this phase of the pandemic, there's really 2 life choices. It's to vaccinate or you're going to get COVID. It is that contagious of a virus.
In Tennessee, the state's top vaccination official, Dr. Michelle Fiscus, says she was fired this week after suggesting some teenagers could get vaccinated without parental consent.
This Delta variant is beginning to bear down on us that we know is more infectious and infects children more significantly.
Meanwhile, the Tennessean says it obtained emails and an internal report from the state's health department that claim it will stop vaccine outreach to minors for all diseases, not just COVID, amid pressure from Republican lawmakers. In a statement to CBS News, the Tennessee Department of Health said, "We continue to support outreach efforts and that it has in no way shuttered the Immunizations for Children program. We are simply mindful of how certain tactics could hurt that progress." But as kids get ready to return to classrooms in a few weeks, Fiscus said she is worried the risk of COVID will only get worse.
So they're going to go back into schools with no mask mandates and no protection from a vaccination.
We talked to Dr. Leah Smith. She's a pediatrician who leads the COVID outreach effort at her church here in Jackson, Mississippi. And she says the toughest group to try to convince to get the shot is younger people. But she says the spike in ICU cases with children going to the hospital could act as a wake-up call. Anne-Marie, Vlad?
All right, Omar, thank you very much. With more on the coronavirus and how it affects America's youth, Dr. Susannah Hills joins me. She's a pediatric airway surgeon and an assistant ENT professor at Columbia University Medical Center. So, Dr. Hills, health experts are saying that children are likely to be at a greater risk when vaccination rates are low. What should parents keep in mind? What should they be doing to keep their unvaccinated children safe as we see a rise in cases? There are some parents who perhaps don't want their children to be vaccinated, and up to this point, we haven't talked about children as being a significant risk of spreading the coronavirus, but parents may want to keep their kids safe nonetheless. So how do they do that?
Yes, I think the first thing that everybody needs to recognize and acknowledge is that we're really dealing with a new pandemic here in a lot of ways with this Delta variant. So we've got to be able to recognize this new environment we're living in and then adapt. And it's hard, but parents need to understand that this virus that we're dealing with now, this Delta variant, is twice as transmissible. Kids are landing in the hospital 2 times more frequently than they would with the regular variant. Adults as well, 2 times more likely to end up in the hospital. And it's really a serious virus that we have to manage a bit differently. So I would first of all really encourage parents to get their kids vaccinated if their kids are eligible, if they're above that 11-year-old range, 12 and up. That is a really great opportunity to protect your kid. We know these vaccines are effective against this Delta variant too. So I would encourage parents who can get their kids vaccinated to talk to their pediatrician about it, to really consider getting their kids vaccinated. And then for folks to remember with the CDC guidance that has come out about masking in school, and let's apply that to camp or group settings as well in some situations where there's a lot of kids in an enclosed area, that if your child is not vaccinated, the CDC guidance still says that masks are recommended. Masks should be used if your kid's not vaccinated. So I would really strongly consider getting your kid vaccinated, wearing masks if they're not, if they're in a group setting, and also to really recognize that this Delta variant is different.
As a pediatric airway surgeon, how has COVID-19 impacted your patients?
I have been in a position to see a couple of different ways that this virus shows up. A lot of kids will test positive for COVID on a routine screening test and not have symptoms at all. But as we're preparing to do a surgery for a different reason, we find the kids are positive. But unfortunately, and this isn't last year, this is this year too, across the city, including here in the hospital where I work, we've had kids who have had COVID-19 be hospitalized. And many of these kids who are hospitalized will have underlying conditions, but not all of them. Some of them are kids who were previously healthy, who end up in the hospital. And this systemic inflammatory disease that kids can get associated with COVID-19 can be really scary. So, it does run the whole spectrum from kids who are testing positive with minimal symptoms to kids who are getting really sick. And I think right now, as we're seeing here in New York, the positivity rate for COVID increase, it's now doubled in the past couple of weeks, the positivity rate. And so lagging that will be the cases presenting to the hospital. I think we're going to continue to see more kids show up with positive tests and potentially show up with greater illness. If you look at that report you guys just showed in Missouri, shows really the worst outcome of COVID-19 in kids, which is that they can end up in the hospital in the intensive care unit on ventilators. And I think any state that has dealt with high levels of COVID has had the same experience at some point with this disease.
So, Dr. Hills, let's talk about summer camps, where at those camps, they've seen a cluster of COVID-19 outbreaks in recent weeks, and some of those outbreaks have spread to the broader community. What do you make of these outbreaks, and are they a type of warning as to what possibly could happen when students return to school in the fall?
Yeah, I mean, it's not surprising to me. We've been hearing about this Delta variant now for weeks and weeks, and now we're seeing cases increase here in the U.S., and we're at a point where recently we've really let our guard down a bit in terms of protection and in terms of using masks and social distancing. So it's not shocking that in these group settings, we're seeing an uptick. Those people in our communities who are most at risk are those who are unvaccinated, and those are our kids right now. So our unvaccinated kids in camps and group settings with this Delta variant are at somewhat greater risk. The numbers were a little bit surprising. There was a report of a camp in Houston, a church camp, where 130 people recently tested positive related to an outbreak there. So there are some really impressive and unfortunate case numbers associated with these outbreaks. So, I'm starting to shift my thinking about summer camp with this Delta variant being so transmissible to thinking about it more like a school setting in a way. Certainly, if your child is going to be in a camp with a number of kids, vaccination status for kids who are under 12, we know is going to be that they're unvaccinated. And if you're in that setting, I'd really think strongly about considering mask wearing and making sure your kid is wearing a mask when they're in that kind of a group, because this Delta variant is different and it is just so transmissible. I think also, just to add on to that, it's really important to pay attention to your location and what the case rates are in your area. So if you're in a state or an area where the case numbers are particularly high, be extra cautious.
All right, Dr. Susannah Hills, thank you.
Thank you, guys.